Talk about this with Dan Holler. He's with Heritage Action for America. And Emanuel is chair of medical ethics and health policy at the University of Pennsylvania. His new book is called Prescription for the Future. Gentlemen, thank you for joining us. Dr. Emanuel, just on first blush, when I see that the Medicaid cuts are still in place, on one hand, that's not going to please the moderates. And on the other hand, the taxes, the Obamacare taxes are back in again. That's not going to please conservatives. So what do we have here, do you think?
Well, first of all, in a large measure, this bill is actually worse than the previous version because the Cruz Amendment actually destabilizes all the individual insurance market, making sure that healthy people stay out of the exchanges. Having only sick people in the exchanges actually going to drive premiums sky high. It's going to be a much worse bill. I would also note that on your list, you did not have as undecided Dean Heller from Nevada, who's up for re-election, and said that he depends upon, he's going to go with what his governor says, who's very heavily dependent upon the Medicaid expansion, and who has been against this bill. So I think Mitch McConnell is not doing well. And if only one more senator goes, you'll then see 10 more senators vote no in the safety of not being the one who's killed it. I think this is actually going down.
Dan, especially now that they're going to retain this investment tax, do you guys support this legislation? Think it should be passed?
Yeah, I don't think anybody thinks that this is the bill that Republicans campaigned on, right? This isn't a repeal of Obamacare. It's not a sweeping replace. But from our vantage point, it is an improvement over the current system. And what you have to understand is that what Obamacare did was it said, hey, people who like your health insurance, we're going to mess around with you, put a bunch of regulations and taxes and restrictions on you, and give something else to somebody else. And the problem is that you messed up with people's plans that they liked. And what we're seeing now in this revised bill with this Cruz-type language is that there is going to be more choice and more competition and more options for individuals who are buying on the individual and small group markets. We're trying to restore that through this plan. That's a good step. It's not sufficient to fix everything that Obamacare broke, but it is a step in the right direction.
Can I just clarify? Clarify one thing?
Go ahead.
The more choice you have, you cannot have choice and the pre-existing disease exclusion so that people with cancer or multiple sclerosis or rheumatoid arthritis can get insurance at the same rate as everyone else. If you want to have the pre-existing disease exclusion, you cannot give unlimited choice to people because then the healthy people are going to choose to be out or get skimpy plans and the whole system collapses. So behind the rhetoric of choice is a total undermining of the system.
Dan, what do you say?
I mean, this is one of the problems, right, is that folks on the left, and Dr. Emanuel too, are saying that it is not okay for individuals to have choice, the type of choice they want, when it comes to health insurance. They can have choice, sure, as defined by whoever's in power and writing the rules in HHS, but that's not really what actual choice is. That doesn't create competition. It basically says 535 members of Congress are insurance commissioners. If you want to be an insurance commissioner, go back to your home state and run for insurance commissioner.
But here's the problem.
Don't try to federalize everything
with
up here at the national level and take away choice and options from the American people.
Here's the problem. My patients with cancer, if we have the system that the Heritage Foundation and Rand Paul want, will not have any choice because they will be denied insurance or the premium will be so high they can't afford it. That isn't choice. That is simply leaving people destitute because they can't afford health care and vulnerable to the system. That's not choice to those people at all. Giving choice to the healthy people who don't need insurance and not to pay actually leaves people who are sick really vulnerable.
Dan, what about that?
Yeah, I mean, again, the presumption here, and this is what we see from Washington, D.C. all the time, is that the people in Washington can micromanage these things and do it well. And what we're saying is, what Heritage is saying, and what you're starting to see come through the process in the House and now the Senate, is that we're going to make sure we restore choice, and we're also going to make sure that states have the ability to regulate their health insurance markets again, like they have in the past. Obamacare took that away from the states. This is simply giving it back. And if you want to have these decisions made, go run for state-level office and vote there.
But if I may, let me get you to address specifically what Dr. Emanuel was talking about, those people with pre-existing conditions, whether it's, cancer, Parkinson's, whatever it is, they end up with those sky-high premiums if they are denied a regular policy, right?
Well, I mean, I think one of the things that you see in the bill, and we're still going through the bill, obviously, but one of the things you see in there is there's a lot of money flowing to states to prop up what would basically become high-risk pools. And it's something that a lot of healthcare scholars has talked about as a way to deal with the chronically ill, people with pre-existing conditions. States use them a lot before Obamacare. So this is not necessarily anything new. We're just transferring that authority back to the states instead of having it all here at the federal level.
Let's remember those high-risk pools were a uniform failure. We did have 50 million people uninsured. The Affordable Care Act got 22 more million people covered. And without changing Medicaid, that's at least, this revised bill has at least 15 million people thrown off of insurance and probably more. That is not a good place.
Dr. Emanuel, to Dan Holler's point, though, there is more money in this. Since they're keeping the Obama taxes in place, they have more money to put back to the states that would help those insurance companies and those and the hospitals to be able to treat those people with those high-risk pools, right?
And we know, so they're adding.
That would be a positive, wouldn't it?
This bill is adding $100 billion over 10 years, $10 billion a year over 10 years in a healthcare system that's $3 trillion. That's nowhere near enough money. It is simply a Band-Aid to buy off particular people who are worried about the high-risk pools. We know that you need at least $25 or $30 billion for the high-risk pools to even have a chance of working. This is totally inadequate, as is the amount of money that they're giving for the opioid epidemic. $45 billion over 10 years. The president's own commission on the opioid epidemic says you need at least $220 billion. Plus, they're giving it in a totally inefficient way. These are not, they might sound like big numbers, but over 10 years, they're very tiny numbers in a healthcare system, and they will not address the problems of the fact that cancer patients will have super high premiums, and people with other diseases or the elderly, older people over 50 are going to pay more in this, not less. This does not address any of the affordability problem.
We have to go at this point. Thank you both for your time on an incredibly important topic right now. Ezekiel Emanuel, Dan Holler.